From 1999 to 2010, retail sales of prescription opioids quadrupled. And as more adults become addicted to these medications, more children and teenagers are also at a higher risk for opioid poisoning and misuse.
The opioid epidemic has grown exponentially. It really began in the mid-1990s when physicians were encouraged to do a better job of treating chronic pain. In 2014, there were approximately 19,000 deaths that were attributed to opioid medications.
Dr. Julie Gaither and Dr. Deepa Kamingay and co-authors reviewed the U.S. pediatric hospital discharge records of children and teens ages 1 to 19 from 1997 to 2012. They identified more than 13,000 children and teens who were hospitalized for opioid poisonings within that time frame. They also looked at 15 to 19-year-olds who were hospitalized for heroin poisonings. The study appears in JAMA Pediatrics.
We found that the rates of hospitalizations for opioid poisonings doubled during 1997 to 2012. We also found that the highest number of hospitalizations were among teenagers, ages 15 through 19. The highest rates of increase in hospitalizations were among our youngest population, which was 1 to 4-year-old children.
Heroin poisonings increased by 150% during this time point, and then very importantly, poisonings for methadone increased by approximately 950%, so almost tenfold in less than 2 decades.
Dr. Gaither and Dr. Kamingay say changes in how we prescribe, dispose, and package these drugs are needed to keep children and teens safe.
Our national conversation has focused on how to improve the treatment and prevention of opioid misuse and abuse. But we also hope that this conversation focuses on how to safeguard children from this epidemic.
Laura Berger, TheJAMAReport.